Dear friends and colleagues in global health, my name is Jeanette Magnus, and I am the director of the Center for Global Health at the University of Oslo. Welcome to this webinar, where we celebrate the new Policy and Peace in Global Health cross-cutting theme at the center. The Center for Global Health is an initiative of the Faculty of Medicine as a part of the 2030 Agenda to meet the Sustainable Development Goals. The center has chosen a few cross-cutting themes, and one is policy and peace in global health. As you know, the SDG number 16 focuses on peace, but policy in global health is cross-cutting and imperative to all the 17 SDGs. On behalf of the Center for Global Health, I'm excited to bring to you this webinar. Professor of Political Sciences, Scott Gates, is the lead of the Policy and Peace in Global Health theme at the Center for Global Health here at UIO. He is also research professor at the Peace Research Institute, PRIO, where he was director of Center of Excellence for the Study of Civil War from 2002 to 2013. His current research interests include global trends in armed conflict, the dynamics of civil war and surgery, the development consequence of warfare, and health policy. Gates has published many peer-reviewed articles and 12 books. He is the editor of Journal of Peace Research and editor of International Area Studies Review. Scott Gates has research experience in both Asia and Sub-Saharan Africa. Professor Scott Gates will be our moderator. Please, Scott.
Thank you. Thank you very much. So before we begin, I'd like to mention a few house rules for this event. When you registered, you agreed that the session is going to be recorded so that we can make the link available to use for those who are not able to join us live. All participants' microphones and cameras will remain inactive throughout the event. This webinar will consist of short presentations by each speaker, followed by a panel discussion and an open Q&A session moderated by me. We encourage you, the audience, to engage with our speakers during the Q&A by posing questions, and you can do this by pressing the Q&A button, which is located at the bottom of your Zoom screen. And you can do this either anonymously or with your name. We have an impressive panel assembled today, providing expertise, perspectives on policy, medicine, law, and ethics. And we're going to consider the issue of vaccine passports. So let's begin. It is with great pleasure that I introduce Espen Rostrup Nakstad, who's just coming on the camera right now. He's trained in medicine and law, and he's a specialist in intensive critical care. In 2018, he published a book with a title that in English translates to Preparedness, Emergency Leadership, and Practical Catastrophe Site Management. Little did he know that in 2021, he'd be the Deputy Director General for the Norwegian Directorate of Health in the midst of a global pandemic. He will present on why does Norway need a COVID-19 vaccine passport now. Please, the floor is yours, Dr. Nakstad.
Thank you for that kind introduction. And I think the question regarding a vaccine passport for COVID-19 is heavily debated in all countries right now. And this, of course, is a policy decision which is most of all political. But it's based, of course, on recommendations from us and from others, and the Public Health Institute, of course. So when we look at ourselves and our neighboring countries right now, the use of this passport has been very different even now in the past 3 to 4 weeks. In Denmark, it's used intensively for a lot of activities in daily life. And the testing regime has been scaled up to make it possible for anyone to test themselves at any time, really, to access various activities and live a more normal life in society. In Norway, we have waited because we have waited not only for the electronic systems to be up and running, and also for a vaccine passport to be compatible with the systems in Europe as well. Most of all, to harmonize the systems with the European Union so that people can travel in Europe without being quarantined more than necessary. So the political dimension of this, which I can't, of course, talk about, but as I interpret it, is a wish to open up more to more people in a safe way, and for a limited time, as it seems now. And my guess would be that this vaccine passport domestically will be used for a few weeks now in June and July, maybe also in August, to increase the number of people who can access concerts and arena arrangements like football matches. That's the kind of activities that we're talking about. And one of the premises for, or one of the requirements for commercial actors to actually host larger numbers of spectators is to have a system available for free testing. Not only so that you can access both as a vaccinated person, or also based on your immunity based on COVID-19 in the past 6 months, or even up to 12 months. But there is also an opportunity to be tested within 24 hours to access the arena and to have the same opportunities, of course, as others. So that's the basic system, really, as it has been launched. And if, to my knowledge, this was only used for the first time yesterday or the day before at a football arena in Bergen, where they aimed at 5,000 spectators to a football match. I don't know if they actually reached that number, but that was the aim. And we will probably see in the area of football, at least, that that clubs will try to maximize the number of fans and others who can access matches. When it comes to the cultural arena, I think the signal has been that most large festivals have been cancelled, and it's too late to actually go back and start hosting larger arrangements. But there could be other things as well that might be open to gain access to more people. But I think the key message is that from a political side, as I interpret it, it is not any intention to limit the access to different activities by this vaccination passport. On the contrary, it's a question about opening up more for more people by using this corona vaccine passport, and to open up for activities that would otherwise not be opened. That, I think, is the philosophy behind it. And as I said, compared to Denmark and other countries, I think this will be of limited use for a fairly short period of time. But it will be used, and it has already been used in the sports arenas. And then maybe even through summer and into August, September, we will see this be used domestically. And after that, I think the passport will mainly be used for international travels. And as I foresee it, my guess is that with new mutations and new strategies in terms of vaccination, maybe countries and the EU as such will be interested in having this as a feasible documentation system and verification system for border crossing also during the fall and maybe the winter of next year. So I think once it's being used, it will be used for border crossing. But in the long run, that's probably where it will be used and not so much domestically. At least that's my guess. So I think that's my take on it. So as a very short introduction, and I'll be happy to answer questions or participate a few minutes more. So I pass the word back to the chairman of the meeting. Thank you.
Thank you. We do have one question already in the Q&A, and what they ask is, it's Josef Noel, what is the role of digital in the policies, and how do we close the digital gap with the COVID passports?
Well, in terms of verification systems, everyone wants everything to be digital, of course, and to be easily accessible to anyone. But still, we have an obligation to open up also for people who are not digital, people who do not have a cell phone, and elderly people who might need help to actually to provide a vaccination passport. So in our work in the Directorate of Health, it's been quite tricky, to be honest, to find good systems, not only for those without a cell phone, but those without internet access, which means that basically you will have to go to either your GP or another person who knows that you have been vaccinated, or can verify that you have gone through COVID-19, and then print out in paper QR codes and documentation that serves as a green card, as a vaccination passport. That's the kind of solution that is being worked on. And it has not, the work is not finalized yet because this is quite tricky. But we are aiming at a system both for digital users and others, so that everybody, 100% of the population, will have access to the certificate for the period that it will be in use.
I have another question, if you can take that. It's from Candela Ignatius Chiesa. What do you think? Why do you think it won't take? Why do you think it won't be much used domestically after the summer?
Because we will probably have somewhere around 90% of the population vaccinated, at least those aged over 18. And the herd immunity will be stronger in most of Europe, is my guess. So at least for domestic purposes, we might not even have regulations for numbers of people as spectators for cultural events or sports arenas. So there might not be a point, basically, to use it domestically. So that's my guess. I could be wrong. Maybe we will still use it during the fall for the extremely large concerts and indoor sports events, for instance. So that might be. But right now, I think it will be a limited use after August, September, although it might still be used, of course, to a certain extent.
Thanks. I have one last question. This is from Katarina Storeng. She says, previously we were told that the contact tracing app Smittestop would make it possible to open society. What's the status of Smittestop? And what does FHI think about how it works, and how is it in competition with the passport, or what's happened, I guess, basically with regards to Smittestop?
I think the Public Health Institute can answer that in more detail, but it has been relaunched as an app that actually works quite well. And it has been emphasized that in June, at least, when we reopen society to the extent that it has been done by the government, it's really important to download it and use it. But it's a helpful tool for tracing and the management of outbreaks. But it's not sufficient, and it will sort of be too late after a huge sports event with 10,000 people to go back to the Smittestop app and start mapping who was there and who has been in contact with this contagious virus. So I think we need both. And Smittestop for sure has been relaunched as a very good tool, and it should be used more. And we do have a challenge to convince people to download it and use it more than they do today.
And Jeanette, you have a question.
I don't have a question. I just want to say thank you because I
Oh.
know he's checking out. So on behalf of the center and the whole community that is listening, thank you very much for letting us snatch you for 10 minutes.
Yes, thank you very much. And thank you for taking the time to ask the questions that were posed by the audience. Very much appreciated. Thank you.
Thank you for having me. Thank you.
Thank you. Bye.
Bye-bye.
All right, now what we're going to do is we're going to move to our more formal presentations from our panelists. The first is Ara Berg. Ara is a pediatrician with a training in a PhD in pediatric infectious diseases. He's worked at the Norwegian Institute of Public Health since 2017, and next month he'll be the new department director at the Department of Infection Control and Vaccines at NIPH. He'll provide a medical perspective today on the vaccine passports. And you can see his title slide right there on the screen, and floor is yours.
Thank you so much, Scott, and thank you for having me. Yes, I'll try to sort of more or less pick up where Espen left on the medical aspects of this vaccine passports, or let us see where the next. There we have it. Yeah, or perhaps we should, for this presentation, I will call it the Corona certificate, because in Norway and in most other countries, these passports or certificates are not only for vaccination. It will, in addition to showing the person's vaccination status, also show the patient status from, or if they have recovered from a previous infection, and they will have be granted, so to say, immunity for the 6 months period after recovery from a previous infection. So they will also have a passport for immunity. So it's a broader, and it's also planned to include recent test status, recent test results, as they have been doing in Denmark, and that's also the plan for Norway. And I will come back to why this may be important, and Espen also just touched briefly on it. Well, just also very briefly, it's been a quite this development started late winter, early autumn, and it's been a really fast-moving development process led by the Norwegian Directorate of Health, but in close cooperation with us at the Norwegian Institute of Public Health, but also the Directorate for e-health and several others. So it's been a huge effort to build this system, and it has this multitude of challenges, as you say, is medical, ethical, juridical, at least also technical and logistical, and it's now falling into place, but still some more work to be done. So what we have now in Norway, just as a brief introduction, we have the Corona certificate. It's gone live. We have this national use now with a verifiable certificate that was launched on June the 11th, where you can use the QR code to see if it's valid. And for now, the plan from the Norwegian government, and also as Espen touched upon, it's to use it in the large venue arrangements like concert, sports arenas, and so on, but also in cruise ships, and a more narrow use, and for the mainly large audience arrangements, not as in Denmark, where they are using it also for cafe and so on. And the next step now is to make it compliant with the EU standards for the certificate, and that will the plan is to launch this just in a few days now. But it is still, and I think the rest of the EU will come in the next few days, but it is a challenge that even though we have the same platform, so to say, what the different countries put into the use and how to use it, and what rules and regulations that are put around the certificate is quite different. And so it's not like having a certificate coming from Norway. It might be different, and you have a green certificate in Norway, and it might not be green when you want to enter into Spain or any other country. So it's quite important to just know. So that's a quite important challenge, and especially when things are happening so fast, it's difficult to make everybody walk in the same direction. And there's of course some medical differences, but also political and others differences. But it's working hard upon trying to find as a common understanding as possible. And this is how it's supposed to look, the EU digital COVID certificate. So going to the more the pros and cons part of this presentation, and maybe to draw up the sort of the main dilemmas in from my point of view, and maybe from the institute's point of view, is that even though vaccination is primarily a medical measure as we see it, it's a way of protecting the individual from infection, and also of course to reduce transmission in the society. But Corona certificate, let me see, it has, maybe it comes now, there it is more to say, not only a medical measure, although it's of course the aim is to reduce transmission and to open up where it's safe to open up with whom it's safe to include into a larger venue, but it will of course also lead to economical and social liberties, and so it's not only a medical measure, and that leads to some difficulties. That you change the indication for vaccinating from a medical to a non-medical perspective in a way, and it opens up for some problems that I think we will discuss thoroughly through this seminar. Just let us start with the medical pros, the medical benefits from this Corona certificate or a vaccine passport primarily. Of course, having this will lead to increased demand. More people will want to have this vaccine because it will lead to a green status in the Corona certificate, and we will have high coverage, and that's of course a huge advantage in a society to have as many as possible, both for themselves but also for the whole society to have as many as possible protected. And that it will also lead to a better control of the transmission in the society. But as we have had quite heavily non-medical interventions in place throughout the pandemic, they also have medical side effects. It is negative for people's health that they are not able to attend school, attend the university, meet each other, and so on. So when we can use this passport to lift earlier for at least the vaccinated or immune groups, that will also have a positive effect on the ones that are able to move around more freely. But as we are seeing now, we are also able to lift quite dramatically now without a Corona certificate due to the low transmission in the Norwegian society at the moment. And let's just look at some of the medical cons and some of the problems with this passport, and of course the most obvious one, and there was a question to Espen around this. The inequality, the problem is the obvious one, perhaps for most of us. Not everybody can be vaccinated. Children, at least under the age of 12 years old, the vaccines are not approved for children under the age of 12 years, and in most countries they are not used below the age of between 16 and 18. Pregnant women are mainly advised against having a vaccine unless they have a medical condition or are in a situation where the benefits may be more important than the risks. And you also may have other groups that are not able to have the vaccines. And of course, this is an access issue as well. Globally, it's quite obvious, but also in different countries and in different areas, and especially if you add the sort of the information or the ability to understand the information that you're getting, and from language, from more health literacy issues, it might be that you are not in that same position to sort of access or take the right choice when it comes to having the vaccine. And also has been touched upon, it is difficult when you have all these measures that are mainly based on digital competency. You have to understand what's happening. You have to understand how to use the certificate, and you have to understand how to get it. But as has been touched upon, we are have this work now in place to find non-digital ways of having retrieving a passport on paper, but it's a bit more difficult than to have the app, to have the downloaded version, and it's not finished yet. So that also leads to inequality, and for large quantities of the Norwegian population and in other countries, of course. But also the trust aspect is important. In Norway, at least, we have a strong belief in that vaccination should be based on information, and that you want to have the vaccine yourself. It's not, we advise against compulsory vaccination. We think that this is a choice for the individual, and we have had a very high trust on our vaccination programs in Norway, with a very high coverage, and we believe that we should continue that way. So of course, when you put this passport into play that has some economical and social benefits, it sort of challenges in a way the voluntary aspect of vaccination, and that could at least be claimed to have something to say for vaccine hesitancy, and if you couple that with the side effects, the dramatic side effects, although rare, we have seen in some of the corona vaccines. If people are sort of feeling that they are more or less forced or obliged to take the vaccine because they need some of the benefits you get from the corona certificate, that could, in the long run, or maybe also in the short run, lead to some increased vaccine hesitancy. And then you have the confidentiality issue also, that your vaccination status is first and foremost a medical information, and with the vaccination passports, you need to share these more widely with the broader part of the society, and that is challenging the confidentiality issue around your health information. And increased demand, although primarily a positive thing, can also lead to some negative side effects when people are wanting the vaccines to have the passport. In Norway, and this is different for the different European countries, but in Norway we say that you only need one dose if you have been previously infected, and that we believe is perfectly fine from a medical standpoint. But it might be that your infection was not properly tested, or that the information is not in the registry, and then you might have a problem with catching the vaccination passport or the corona certificate, and then you need a second dose on that for that reason, and that leads to sort of over vaccinations. And that could also be from vaccines not properly registered or registered outside of the country, and so on. So you may lead to more people wanting to have more vaccination than they actually need from a medical point of view, just giving that you have the corona certificate. And then, of course, maybe more importantly, when it comes to the larger scale, it's said that new groups may have a push for vaccination, and children is, of course, the most obvious one. And the WHO have sort of a warning out, or they say that let's look at the global issue here. There's a lot of countries not having the vaccines, so please be a bit restrictive when including more and more groups for common vaccination that might not need it for for themselves, or at least we need to think the global situation, the global supply situation, and the whole society, the whole world needs to be vaccinated before this pandemic is truly ending. Well, the medical cons is also increased transmission. Increased travel is, of course, what we want from these passports, but it also can lead to more spread of variants. And even having, since you have included the recovery from infection in the passports, you could actually have an incentive for wanting to be infected. And lastly, we have put some countermeasures, especially for the inequality aspect, and that is testing as an option, because if you are not able to get the vaccine, then you can at least get the test. And we should wait for the introduction of the certificate until a substantial part of the population is been offered the vaccine, so it's not that large inequalities in the society. And we should only, as Espen mentioned, use it for leaving restrictions already in place and not putting more restrictions on people that you have to have the corona certificate to get access to things that are already opened. And only for a limited number of activities. We believe in Norway as in large venue activities and so on, and have some strong governmental regulations, so not every restaurant put this corona certificate on top of already restrictions in place. And we also believe that a short duration, as Espen talked about, is the right way to go. So to sum up, it's good for increased demand and high coverage, but potentially for the wrong reasons. So thank you.
Thank you very much. That was enlightening and very thorough perspective on the medical perspective. What we'll do now is we're going to turn to a legal perspective, and we have two legal scholars. We have Kristen Berg Sandvik and Mona Naomi Lindtvedt. And Naomi Lindtvedt is a lawyer and a doctoral research fellow at the Norwegian Research Center for Computers and Law at the University of Oslo. She has extensive experience with privacy and data protection issues, and in particular on digitalization initiatives. Kristen Berg Sandvik is a colleague of mine at PRIO at the Peace Research Institute Oslo. She's a professor at the Department of Criminology and Sociology of Law, and she's the co-founder of the Norwegian Center for Humanitarian Studies, and she has published extensively looking at humanitarian aspects of law, of issues of digitalization, of drones, for example, and broader issues of privacy and such things. So the two of them are going to present a presentation which is entitled Digital Pandemic Governance and the Making of COVID-19 Passports, Ethical and Legal Perspectives. The floor is yours, Naomi and Kristen.
Thank you. We're splitting the time, and thank you, Scott. So I actually suddenly have a PowerPoint. Thank you to the two previous speakers. I thought that was very interesting. I'll do sort of a social legal framing of the issue, and then I'll leave to Naomi to deal with the human rights and legal aspects. So I have, as Scott said, I usually have worked on humanitarian studies issues abroad and on technology and innovation for a long time, including wearables, drones, and cybersecurity. And then being sort of stuck back home, I started working here. And I've had a very interesting year. We have formed a group of 10 academics, medical professionals, professors, philosophers, and law professors and legal scholars. And together we've basically, I suppose, spent the last year as an NGO, sort of writing op-eds, blogs, doing interviews, writing petitions to the government, participating in working groups, and generally almost behaving like activists. So for those of you who are interested, the website is up. Most of the stuff we have is in Norwegian, but literally we've collected everything. And the starting point for our joint engagement was was a concern about the rule of law. I mean, there's been a lot of dugnad in Norway. People have been very diligent and the authorities have been very convincing. And there's been relatively little critical objection from the academic community in particular. So I think this is what we've tried to contribute as a part of legal accountability and sort of democratic engagement. I also want to highlight that we're not the only ones. So particularly Katarina and Antoine have done a fantastic job, sort of locally, domestically, and internationally. But most of the engagement we've had, sort of all of us, started with Smittestopp, which was a rather infuriating experience of kind of a product that didn't work, extremely aggressive posturing by the makers of Smittestopp, and a lot of promises of if you downloaded this, we would be able to open the country again. And then I think the Smittestopp context is important to understand where we have wanted to go with the vaccine certificates. I'm now not saying vaccine passports anymore, and I should say vaccine certificates, yes. Which means that we've had a lot sort of more limited expectations and hopes for what the certificate could do. But we've also, I think it's important that we see both instruments as both tools of sort of digital pandemic governance, but also as part of the digital transformation that the Norwegian society and other countries are going through. So our contribution, Naomi and myself, is mainly that we think that domestic case studies have value for gauging sort of global justice and humanitarian value of vaccine certificates, but generally the pandemic response. And also we can think about the certificate as a tool of international collaboration. Apologize for the typo. So if the EU, for example, can make this work, it's actually a fantastic thing for the Union in terms of how it can streamline its health policies, but also health sort of services to the population. We think that it's really necessary to have a multidisciplinary critical approach to unpack these passports and to see the broader questions. So I'm trying to think about this, and I have 5 phases for you, and you can disagree with this, but it's an attempt to sort of start structuring my thoughts around this. So before this pandemic, I mean, there were a lot of digital tools and experiences from previous efforts to tackle pandemic, such as Ebola and SARS. So it wasn't unprecedented to try to use digital tools, and there's a lot of experience to draw on. I mean, I'm no expert on these previous tools, so I think the jury is still out as to whether we did effective learning as a community. But at least in Norway, there was somehow a feeling of reinventing the wheel with Smittestopp. And then, you know, Smittestopp obviously crashed and burned, and we have a second installment also called Smittestopp. The first one was deemed to be illegal. It seemed like no one has really anything much to object to with respect to the second Smittestopp, but it also doesn't seem to do much. So last year, we spent about 6 months imagining passports as a future solution to the pandemic. And of course, we were all familiar with the yellow cards that we have to show crossing many borders in the world. So there was nothing unprecedented here. In terms of critical engagement, you know, early on, there was a reflection of whether this is really a solution in need of a problem. In the humanitarian field, we see many entrepreneurs coming up with some apps or technical gadgets, and they would like customers. And then there was skepticism about, you know, what the certificates were actually for, or rather a politicized problem framing that needed unpacking. You know, what sort of governance effort is this? Who's interested in this? Is this just big pharma? Is this something my government wants? What about my sort of social justice concerns? The second phase starts when vaccination is underway, and this really becomes sort of a current concern in democratic states. And I would say that this is publicly from about January this year. And at this point, I'm sort of reflecting back on what we have written and thought about this. So I would say that this was probably a phase of technological determinism. So there was an overestimation of the ability of the certificate to set us free and unlock society, but also maybe, I'm just saying, maybe a bit of totalitarian fear mongering by anti-vaxxers, but maybe also by academics like myself. On the other hand, I think that critical engagement is necessary, and I think that has really been an important ingredient in the making of the vaccine certificate. So with respect to Smittestopp, it was easy to talk about, totalitarian surveillance and how the government really hadn't been transparent about the dual uses for Smittestopp. But, with the vaccine passport, everybody wanted it. The population was crazy to sort of have the certificate. It wasn't unpopular, it was super popular. Well, which makes it, even more tricky to sort of engage with critically. So in the third phase that starts maybe in March, April, we discuss this, we try to figure out the context, we debate the concerns, and the previous speakers have a very eloquently described discrimination concerns. There has been issues of surveillance, creation of cyber insecurities. Once you have an app, you also have a target. Fraud concerns have been discussed, but maybe not as practically as they could have, and I'll get back to that later. And I just say that we've had ethics debates here, and the speakers coming afterwards can sort of comment on this, but with these digital tools, it's been almost like medical ethics has been the only game in town. I think it's unfortunate that we haven't more seriously engaged with tech ethics and social justice issues and involved experts on those issues, because I do think that legal ethics and tech ethics, for example, have different vantage points than medical ethics. And I think that sort of prioritization of expertise has been unfortunate also with the Corona Commission. So FHI, I can't remember the English acronym, is tasked with this in late February, and I just noticed 3 aspects here. And the third one I'll leave to Naomi, which is her presentation. So there's this idea that the EU is forcing Norway's hand, but at the same time, there's something really interesting going on with how the Danish net company is successful in getting to deliver on the procurement here. So Netcompany basically came to the rescue of the Norwegian Smittestopp 2 and did a fine job, very kind of collaboratory, and had been sort of well respected. But they came in with a very sort of forceful imaginary around, how you would use the vaccine certificate at family parties, and from a since deleted thing on Facebook, there was this family party where the grandma is basically scanning everyone else's phone before they can enter the party. So it almost felt like they had a very sort of intrusive idea of what this certificate would be used for in Norway. And then as to the local politics, so I've been sitting in these reference groups and trying to help out in the working groups for the certificate. And the day of the launch, the FHI had still not been told by the government what the certificate was going to be used for. I mean, it's been absurd to sit into these meetings with a host who doesn't know what it's going to be used for in terms of private use, for example. So we were doing risk assessments, risk scenarios, without knowing what it was going to be used for. And this, I've been very forceful on getting the hosts to archive the engagements we had on this, because I think this is really odd. If you're going to use a pandemic tool like this, you have to make a political and legal decision early on. And you can't sort of wait until you have developed the technology. And then I'll leave the last one to Naomi, but we're entering a 5th phase. So it's rolled out, and Nakstad sort of said, this is actually not going to do that much. It's going to be helpful, but it's really not going to take over our lives because we have vaccinations. But then there are some issues on the horizon. There's been a massive Swedish fraud case now, which I think we really should look more into. The Danes, which have based their certificates on a political compromise, they have said that they will fold their certificate. And I really think it's going to be helpful to study that folding carefully. But there are outstanding questions about how long this pandemic will last, who gets to decide when it's over. This politics of dangerous mutations that we've heard about all the time, that's what viruses do, they mutate, right? But in the context of this pandemic, that's been treated as something sort of sensational and new. And then there's the business of vaccine top-ups and vaccinating children and sort of the medical basis for doing those things. And the lobbying aspects, for example, big pharma. And of course, there are Outstanding also questions about global vaccine equity and transplants of these certificates, and inevitable questions about mission creep, surveillance, and the appropriation of data for new usages. So we've seen that in the context of the tracing apps, some police forces ended up using the data, for example. So I think we also need to pay attention to, what the legacy of these certificates will be. Okay, I think I overspent my time, but I'll leave it to Naomi now. Thanks.
Yeah, so we can very lightly touch upon the human rights issues that we see that it, as mentioned before by previous speakers, the corona certifications are promoted as a liberator. By using them, we can lift restrictions, and thus there are no infringement of human rights. But you can also look at it the other way, that you can see that we don't lift the restrictions fully, we keep some of them, and we uphold them, but we allow some exceptions. And what is the price for that liberty? Well, the price for that liberty is that you have to use and show your health data and your ID data to get access to society. So if you look at the normal situation, in a normal situation without a pandemic, we can move freely, more or less, with some restrictions, without telling everyone who we are and whether we are vaccinated or not, or whether we are ill or not. So in that respect, if we compare the use of these certificates with the normal situations, we do have restrictions of our rights. And what we can see as consequences of this is that we normalize or we extend the use of personal data to the public domain, and we normalize the use of also of health data, which is not only considered sensitive, special categories, which has even more protection when it comes to data protection legislation, but is also protected by very strict confidentiality rules, and is normally something you can keep for yourself. Because what happens with the vaccination passports, or whatever we want to call them, is that what kind of data do we need to include? From the Norwegian perspective, it might seem a bit strange, some of the debate we see in other countries, because we are so used to our data. We all have unique IDs, which are centrally stored and used every day. Many other countries do not have that. They are not even allowed to have that because they do not want a state-owned registry with the whole population. We also have in Norway very centralized health registries. Not all the countries have that. So what we see as normal is not normal in other countries, which means that with the introduction of these passports, what do we need to do? Do we need to build more infrastructures and health registries, for example? And what consequences will that have? It was mentioned that the negative tests need to be included in the certificates, because otherwise the non-vaccinated would not have access to these services and to society. So that is quite important to not let the passports be that discriminatory. But have you thought about what that means? It does mean that your negative tests need to be stored as well. Today or previously, only the positive tests were stored. So for how long will these negative tests be stored? And can we imagine that we will do this with other communicable diseases? In the Norwegian registry for communicable diseases, there are 72 diseases that are monitored. So can you imagine that all your negative chlamydia tests would be stored forever and may be used in a similar certificate? Because why can't we extend it to other diseases, for example? So that is an important question. What data should be used and what are the consequences? Because by making a digital solution, we also create vulnerabilities. And what we see in the Norwegian debate, they say that, no, before we have the digital certificate, we can't allow anyone to enter our country. We can't because we don't trust the documents. Why don't we? Or are we using it as an excuse to uphold restrictions? What I find curious, as someone who has worked with digitalization for a long time, is And of course, I applaud an acceleration of digital solutions. Still, it is a question, when did digital tools get this status? What happened? In the Norwegian context at least, paper and digital are equal. We have worked for many years to get the digital solutions to be accepted as well as paper solutions. Suddenly, the digital solutions has a higher status. What happened with this passport? Could I use this today? Could I go to my GP and get my vaccination registered in this and use this when I cross borders? If I can't, why can't I? Because this is an officially recognized documentation for vaccines. And in my passports, I do have more than my yellow fever vaccination registered. Instead, it is the digital solutions which are now considered to be the safest ones. And we do not have the paper solutions at hand. But also what we do have seen is this discussion about how secure do the digital solutions need to be. Christine mentioned that we do expose ourselves to other vulnerabilities. The Swedish registry for communicable diseases is hacked. So they don't have updated data right now, which can be made available. Another thing we see that we seem to now discuss how much data do we need for also the digital solution to be secure? And what we do see then as we can't even trust that. We need to verify that you are you. And by doing that, we also introduce some kind of ID duty, because in many countries now, including in Norway for domestic use, they say that it's not sufficient to show your digital passport. You need to bring an ID. And as we know, even in Norway, not everyone has an ID. In Norway as such, there is no duty to show ID at any point, not even the police will do that without having a reason for that. So it's just to give you some examples of what we may seem as a very easy digital fix actually brings with it a lot of other vulnerabilities and risks, and it intrudes, we can't see it as an isolated app, which many do, that is naive. It is not disconnected from other infrastructures and registries, and it is not disconnected from the societal impact and how it may change our relation to our own health and how we look at our own health data. Thank you.
Thank you very much. Thanks, Kristen and Naomi. Those was very stimulating presentations. We will now turn to an ethical perspective, and it will be done by Ingrid Miljeteig. She's an associate professor in medical ethics and the deputy director at the Bergen Center for Ethics and Priority Settings. She's trained as a physician and conducts empirical research on ethical challenges and priority setting dilemmas in low-income settings. And you can see the title here. The title is Ethical Arguments for and Against Vaccine Passports. The floor is yours, Ingrid.
Okay, thank you. And thank you for inviting me to this webinar. So this is not, as the previous speaker is my special field, but I've tried to use some time to dig into the papers and blogs and also Twitter discussions that have been there almost a year now since the beginning of the pandemic. And I will try to give you a very short introduction to that. And it's quite interesting to see also how the discussions have evolved, going back to the first papers that were published around 1 year ago. There were no vaccines, and also much higher uncertainty what the pandemic would look like, what kind of vaccines we will get, and also how people would react to this. So that has been interesting. So Just briefly, and I think we have already heard about some of these concerns. So we as ethicists are, of course, very focused on what kind of trade-offs are there between important values, ethical principles, and especially then if it can bring more good, the beneficence versus non-maleficence, if this can bring more benefits to us or burdens, and how this is distributed and for who will have the benefits and burdens. And that's those discussions are very much linked to the discussions and different perspectives on how this will influence equity, or actually inequity, and also fairness. And I will come back to that, but it is, of course, a major concern that those who do not have access to vaccines, and that is the majority of the world still, especially in low and middle income countries, if this vaccine passport will give opportunities for those who are immune, either due to going through the disease or being vaccinated, and if only they have the possibility to, for instance, travel, it will be a matter of inequity for those who do not have that opportunity. On the other side, it's also discussion about fairness for those who are vaccinated, because if we look back at why we first had all these restrictions on our freedom, it was to limit spread of the virus. So we kind of had our freedom, then it was restricted. And if you have a lower risk now to impose harm on others by spreading the virus, how can it be fair to still restrict people's freedom? We will come back to this a little bit. And then another concept have been discussed quite a lot, namely solidarity. So as I think Are said, we will be vaccinated because we want to protect ourselves, but also we want to protect others, vulnerable others. And then it seems to be a third concern, namely more like a social signal or a signal of solidarity, that this is something we have to do together. And then, of course, there is a challenge with those who are hesitant to vaccinate themselves of various reasons. Or also, I think what has been mentioned, that vaccination should be voluntarily, and if you have only some opportunities, if you are vaccinated, this works as a nudging for some, and it might be felt more mandatory to be vaccinated to take part of the society again. And we know that that might be a problem, and especially related to trust in authorities. So trust is a much discussed field in this of various reasons. And I think Naomi and Kristin also talked nicely about this, that is related to also how we collect data, the privacy issues, and related to the patient autonomy, that who will have control over our health data, how will they be stored and used, and so on. So this is also related to trust, that in the middle of a pandemic, it's a challenge if we risk decreasing trust. Then, especially in the first papers and discussions that were there, very much were very uncertain, and not only related to how the vaccines would work, but also related to, will we manage to detect who are immune or not? So the testing, sensitivity, specificity of that was also, and still is also, a challenge. And that means that quite a lot of decisions that has to be made are made on a partly uncertain ground, and then value judgment comes into those decisions. But I think I should turn to what I think is the most important challenge, and especially here in this forum, where we look more maybe on the global side also of what the vaccine passports will mean. So equity concerns have been much debated, and like WHO have been very clear. They even said that vaccine passport is a catastrophic moral failure, which is very strong wording. And they explain this with how the vaccine passport will increase inequity. The inequity that is already there in access to vaccines, but also, of course, inequity in health in general. And that if it means that you can only, for instance, travel or access work or do other things that's not about going to a football match or travel to Spain on holiday, but things that really, really matter for how people can survive and have a good life. And if you need a vaccine passport to do these things, and those who have never got the chance to have a vaccine will not be able to, for instance, travel to a sick relative, that is viewed as discrimination of the non-vaccinated people. And they also call this, it's a privilege for the already privileged. And you can see on this figure here that if you look at the x-axis, you see doses per 100,000 population, and on the y-axis, you see GDP per capita. And then the colors of the dots here showing if a country is using or are considering using some kind of a certificate for travel. And you see the correlation between being wealthy, providing vaccines, and also then planning or providing a travel certificate. So in one way, it can underline this, that this is us, we are the privileged here, and we can have the vaccine passport. Then there comes up quite a lot of discussions of the principle of equal treatment, how that works in this. And it's a strong ethical principle that you should treat equal cases equally, although we have seen during the pandemic that sometimes it's a deviation from this, for instance, that we have given higher priority to healthcare professionals in giving them vaccines first. So, but looking at the other side, I don't think it's many that will not agree that vaccine passports can increase inequity, but as some hold, like Brown and others, that still the overall benefit is potentially higher, because what we want is to safely reopen the society, to try to go back to normal, and then the vaccine passport can be an efficient and ethical tool along the way. And this will also then benefit those who are worst off due to lack of vaccines or the pandemic itself. Also, as Are pointed out, that it can be an incentive for vaccination, and that means that we can acquire herd immunity earlier, and that will also benefit more people. Then, for instance, a well-known bioethicist, Arthur Kaplan, said that there is no principle which holds that no one can do X or have X before everyone can do it. Like, for instance, here in Norway, when we discuss if we should fund a new cancer treatment, it's not like we take this global inequity discussion in all what we are doing here, like we cannot provide this cancer treatment before everyone can have this in the world. So why should we do this when it comes to this vaccine passport, and especially since it means that we might need to level down for those who are immune, or at least hopefully partly immune due to the vaccine and that they had corona. Why should they not get their freedom back? And they oppose this view that it is a privilege given to those who have been vaccinated, but rather that all of us who have been restricted in our freedom, the restrictions are withdrawn. So it's a little bit of a linguistic question here, maybe how we say it, but morally it's a difference between being given a privilege versus that your restrictions are taken away. So as you see, I try to view that there are different views on this. Well, so how to conclude? It's quite understandable, I think, the view that WHO and others hold, that as long as so many of the world's population have no access to vaccines, and that we in the high and higher middle income countries have got around 80% of all the vaccines, and maybe 1 out of 3, 1 out of 4 of us are vaccinated here, while in a low income country it's maybe 1 out of 500. It's very difficult to kind of argue from an ethical perspective to provide this. And not only because of inequity, but also because there are still concerns for safety and for how long this will be. And if you are vaccinated and go to a very vulnerable society, you might still risk of spreading the virus, even if you don't get sick yourself. Another issue that has not been discussed enough, I think, is how stakeholders are involved in these discussions, especially those, of course, that are mostly affected by the pandemic and the lack of vaccines. What do they think about this? And lastly, and I think most importantly, is that the big issue here is the gross inequity in access to vaccines. And of course, that shows in access to vaccine passport, but we should continuously discuss that and do something about that. Yeah, thank you.
Thank you. Thank you very much. Good. So now we're going to turn to the question and answer session. I guess I'm not sure if Espen's still here. If you are, you're most welcome to be participating in the question and answer time too. There was one question by an anonymous attendee that came up when during Ara's presentation, and that was, does the EU also include the UK, and where does the UK fit in all the policy?
I'm a bit uncertain where they sit and what their position is, but they are involved in the process in the EU or in the European context, but I'm not sure about their position. Maybe other than me know more about that.
Does anybody? I don't know myself. I guess we just don't have an answer for that. I mean, but there is coordination, policy coordination with the EU.
They're very much involved, but I'm not sure about how the UK side looks upon it.
Yeah. I'll go to another question. And one of the themes, especially raised by Espen, had to do with the short-lived policy and the nature of the short-lived policy. I want to take that up as a question. As they're being discussed today, is this going to, will the policy remain, and or will it indeed be phased out, and what would be the nature of a phase out? Anybody want to take that?
I can just start it and other can fill in. I know that most countries are discussing that you should have the sundown regulations when starting on these certificates. But I think, as Espen said in his introduction, that it will stay for quite a while when it comes to international travel. But hopefully, and at least from my point of view and the FHI's point of view, we think that it will end up being a more a negative regulation than a positive opportunity when more and more people becomes vaccinated, and then we will have a smaller and smaller community that being left out of the goods and the liberties. So it should be lifted, from my point of view, as soon as possible, and I think that should be quite early in the autumn when we have a quite high vaccine coverage, most likely in Norway, as it looks now, and I think in many other countries. But for the international travel, then you have some other issues when, and of course, importation of new strains and new variants is an issue. But it can be debated if it's a good enough reason for the restricting travel internationally. Over.
Yeah, Kristen, you want to comment?
Yeah, no, I mean, I think one of sort of the legacies of this pandemic is how quickly and comprehensively sort of the emergency logic of the pandemic takes over. And I see some of my colleagues from humanitarian sector here in the chat, and you know, we have long discussed how, you know, normal rules of engagement are suspended when you are in a crisis and you need to do something and do it fast. And I think that it would be great if we could have conversations about sunset clauses, for example, or about the transparency of intrusive initiatives, or about the relationship between biomedical knowledge and epidemiological knowledge and lawmaking, and the need for transparent lawmaking. For example, I mean, the corona hotels is a really an issue that we need to discuss after the pandemic. But I'm also concerned about sort of how we assume that things are rational, right? So 3 months ago, you know, you were basically a conspiracy theorist if you tried to discuss the possibility of this virus escaping deliberately or by accident from a Chinese laboratory. And now the Americans have decided that we can actually talk about this, or should talk about this, or it's unclear, right? So I think, you know, the forces behind how we construe the pandemic and the very, you know, obvious financial interests in prolonging the pandemic will shape how policies are made as well. And I think it would be great to have a domestic, but also a sort of international debate on this. Thanks. And yeah.
Naomi, did you want to say something?
Very shortly, the EU certificate is supposed to be used for 12 months maximum, but there will be a 4-month reporting period. Well, after 4 months, it should be reported to the European Parliament about use, and the Norwegian law has a 6-month clause, but it still depends to see how long it will be used. I think my concern is more how it had entered the Norwegian debate. At least I find the EU debate more balanced, very much more concerned and more, I would say, knowledgeable rather about the negative effects and how it should be used and not be used. So the EU certificate is not mandatory for the countries to introduce, but they are obliged to respect the validity of certificates if anyone comes with it. But they do not have to make this solution themselves. So that's a very big difference. And also, I am a bit concerned about the more long-term effects of this evaluation, I would say, of the paper certificates, because now, at least in the Norwegian debate, the digital is giving such a premium quality, then even if the EU, if they actually stop using these certificates in 12 months time, what will happen with us then when we have now like put all our eggs in the digital and said this is the only thing we can trust, and we can only trust what comes from our own registries? So that's my concern, and kind of how we now are trying to say that everyone else may be cheating, so that's why we need this, and we need to do it this way. So we may see long-term effects that goes beyond the regulation, although the regulation has sunset clauses.
What role does the digital ID industry play in the politics of the digitalization?
I mean,
yeah, you do.
We see it as a lot in the humanitarian field, and there is obviously very good reasons for giving people ideas. You know, so a child can enter a school, so you can get a bank loan, so you can get a passport. Increasingly, a digital idea is being intertwined with the legal idea. And we see this particularly in refugee management, right? So you're no longer actually able to have protection unless you can give up all your biometric data, for example. So you know, as Naomi said, we don't really have that kind of difficult relationship to this in Norway, because we're so used to our data being stored. You know, after this, I'm going into a different European project on the Human Brain Project, where I'm asking for much more transparent conflict of interest registries. And, you know, I come from a culture where we, you know, tell the public what we earn. I mean, for other countries, that's like, oh my God, I can't believe you're doing this. So there's cultural difference here. And I think for us, it's a combination of being naive and and being used to this. But so this is again where we're cycling back to this issue of big tech and who owns the data and what are the interests. And the more legible we are, the more money you can earn on the data of regular people. And as Naomi said, there's why not measles? Why not something else? And we haven't touched upon this in this sort of webinar at all, but the weaponization of vaccines here, and how the far right and the far left have sort of met and they hold hands on this, and for us and Naomi, myself, and Hans-Petter Grave, others, and we've written a lot and published a lot, and we've gotten a lot of love from sort of right-wing extremists and left-wing extremists, and it's uncomfortable, right? Because we're trying to be critical, but we support vaccine schemes. We support primary vaccines. We're very much for science. But there's a political context here, which is very difficult and which is at the center of the democratic struggles of the European Union in particular.
Thank you. This is a question for Aura. What's the argument for not accepting non-EMA approved but WHO approved vaccines?
I was about to write a written answer, but we can take it here orally. Well, the EMA and that's a regulatory body. They actually approve vaccines on or other medicines on behalf of the EU and the EA's countries. The WHO, they only pre-qualify in a way. Of course, they sort of put an approved stamp on it, but it's not a regulatory body, so it's not officially approved when it's went through the discussions in the WHO. So it's a regulatory issue there also. But this is a discussion that's going on within Europe. Should we open up for a broader, for also the WHO pre-qualified vaccines as they do in some countries? So we haven't finished off that discussion, but it's a matter of regulatory issues, and it's a matter of information being available for us to evaluate the vaccines ourselves.
Thank you. Here's another question from Prudencia. What happens if one is fully vaccinated and has a vaccine travel document or a certificate, and then gets a COVID-19 infection? What's the implication under such a scenario?
Maybe this is for me as well.
I guess it is.
Yeah. Well, if you get an infection despite being fully vaccinated, then you should get tested if you have symptoms, of course, and then you will be isolated and spend your time in isolation as everybody else, because none of these vaccines are 100% effective. So, but it will not lead to any the different status afterwards. You will go back to your green status on your corona certificate. You sort of have almost a double green one.
Yeah, I guess that's an aspect of the certification, is that you're testing negative. So it's not just having the vaccination. That's an aspect of it. This is a question that regards equity considerations. So maybe we can direct it at Ingrid and then others can jump in on it. Elena Dalla asks, another equity consideration is whether and how to consider the data on the fact that one has had COVID-19, but outside of Norway or the EU. So I guess that has to do relating to verification about having had the disease or the nature of your vaccination, and verification of those things as an equity issue, I guess is really, it's more of a comment, but you want to react to the comment.
Yeah, and I think in a way it illustrates that even if the vaccine passports are not there or not decided upon, it will be questions how we can document our immune status when we are traveling. So what has been suggested is if in a way, like we know that this is already in place, that it is asked for what is the status, have you been vaccinated, or what's the status of your testing? and in a way just accepting that that is how it is, and regulate then what is the necessities to be able to travel. And I think that is highlighted also that it, as an equity concern, that it should be other options than only the vaccine passport. So for instance, showing negative tests and so on. And I think, at least, I don't know if that's a reply to that or comment, but at least something that has been highlighted.
It's relevant. Kristen, you have your hand up.
Well, actually, I had a question for Ingrid. I don't know, I couldn't figure out how to put it in the Q&A.
Oh, but just ask it.
Okay,
verbally.
so I've looked sort of around a little bit on the state of COVID certificates, and it's probably less firm deal than we feared it would be a couple of months ago. But if you end up having to have the certificate to cross borders, there will be a slot for children, right? So the certificate will almost drive the need for children to get vaccinated. And knowing that they seem to be less affected, but maybe have a propensity to get side effects from vaccines. We saw this from the swine flu, terrible stuff. I just wondered about, the ethics of vaccinating children for something they don't get really sick from, to save our butt. Pardon my language.
Yeah, I think that's one of the issues. It's one of the many issues that this leads to, that both that you use vaccines on children that should have been used on health workers in a low-income country, but also the potential side effects. And I think that's something that WHO also highlight, that the side effects and the long-term effects of the vaccines are not yet fully explored. And that's why they also say that people who are reluctant to be vaccinated, it's still legitimate reasons for saying no. And I think especially for children, it might be many that will not vaccinate their children. But if you have to do it to travel, then you are in a way nudging people and almost enforcing people to do it. And that's of course both a ethical but also maybe a legal issue that needs much more discussion.
Thank you. Ara, you have your hand up.
Yes, I just wanted to comment on this also, because it's a very important point, and I think that's one of our, from the FHI's point of view, one of our main concerns, that this corona certificate sort of drives a non-medical medical intervention driven by a non-medical need in a way. So because there's a quite, we are now performing a quite thorough investigation on the need for children to be vaccinated, and of course these concerns around side effects are one of the crucial things, and we should not let the corona certificate lead the way in that discussion. We should let the medical issues lead that way. So it's a really important one, and we are in Norway discussing that we should have a age limit for use of corona certificates, but it's more difficult to lift that in the international context. This age limit. Over.
Thank you. Related to that, kind of related to the general discussion, is different policy actors, especially within the EU, have different priorities, different goals, different policy orientations towards vaccine certificates. What are the implications of those different goals and priorities by different EU actors, and how do they affect us in Norway? Anybody want to take that one?
Yes, I can. And that is why they have tried to unite, with their regulation on the COVID certificates. Again, a very heated debate and many different views within EU, so which should not be underestimated. As I mentioned, this is highly controversial in many countries, kind of making a common certificate with this information. It is also very much debated whether such a certificate should be used at all. So what we do see now from the EU is kind of a common stance, but still, I think we will still see various handling of this. Remember that many countries, those that have pushed mostly for the certificates, is to save the tourist industry. But also these countries now, you can still travel, you can travel to them already, not having to show their your certificate. So what we do see is that this regulation is in place to ensure that you can travel freely, and that is very important. The aim of the EU is the internal market, is there's a free flow of people. It's not to put restrictions in place. And the certificates can't be used to bar people from entering the country. And I think that is somehow lost on many who discusses these certificates. And what will be interesting to see is whether the EU will also have a common stance when it comes to travelers from third countries, because they also have in place a certificate for that. And maybe that will also push some countries like Norway with more restrictive policies to allow, for example, people who have been vaccinated in the US, where we do not recognize vaccination papers, or in China, for example, or in Russia. So that will be interesting to see. So, but I think this debate is not gone, but therefore, I think we will see that the certificates will be used as long as it will be able to promote the openness of the EU. And if it turns out otherwise, then the Parliament actually may close down the Sheen a bit earlier, maybe. So we'll see.
Oh, really interesting. Kristen, you have your hand up.
Yeah, no, I mean, I just going into this. So a couple of months ago, the European Court of Human Rights came down with a verdict against or for the Czech Republic, supporting the government's quite wide margin of discretion to bar children from school, for example, if they had not gone through the basic vaccination program. So you know, if you look at this verdict, but also sort of, you know, the kind of wonderful governance tool that the vaccine certificate can be, you know, we are sort of back to more traditional discussions around, you know, public health. And I really hope that we're going to be able to have them freely. You know, I was just reading this piece on how, you know, someone on Fox News had said that, you know, people die of vaccines, and he was, you know, labeled an extremist. And then, you know, I thought about, you know, the discussion we've had on AstraZeneca, and where I thought it's been very interesting, because different countries have different trade-offs in light of the sort of the impact of the pandemic. But I do think that we need to keep an open debate and you know, really try to invite in a variety of perspectives and rationalities. So if refugees are skeptical against, you know, vaccinations, it's also probably because in the past they've been subjected to mandatory and unethical vaccination programs, for example. So just this need to have, you know, seminars like this, but to have a plurality of voices and sort of, you know, table difficult questions and see this as more than a medical question, as more than a technical question. I think that that's the way we need to go, because I think, you know, the certificate will not disappear, you know, once the sunset clause is set in. It's going to linger as a possibility.
What's the way to, this relates to one last question by De La Salle. What are the implications for abuse of the, if it's going to stay in place? I guess it's the open debate, other ways of, I guess, through regulation through the EU Parliament and through the Norwegian Parliament. But I think I answered the question slightly. We're out of time. I really want to thank the audience for excellent questions. Really apologize if we didn't get to your question. Thanks to the panelists and to Espen for a really super fascinating time. I had high expectations for this panel, and my high expectations were exceeded. I'm really happy. I learned a lot here. Super stimulating discussion. Very pleased with you having participated. Thank you very much. And Jeanette, you want to?
Yeah. Thank you very much, dear presenters and participants. Thank you for a very motivating webinar, very interesting and thought-provoking reflections and discussions. And it's clearly that the vaccine passport discussion positions the nation states' concerns and needs with the global situation and the needs to limit the pandemic, as well as all its impacts, the syndemic that is coming. And to you, Scott, thank you very much for skillful moderation. And thank you to Gabriella and Ingeborg for back office coordination and planning. And thank you to all of you for participating and joining us this afternoon. And have a blessed day and stay tuned. We will be back with some more. Have a great summer, all of you.